Okay, let's now talk about deep dry wounds. And a good example of a deep dry wound is a dehisced surgical incision. We see a lot of these in abdominal wounds and some thoracic wounds. So what are our goals in managing these wounds? Well, again, if I have tunneled areas or undermined areas, I want to wick any fluid from those tunnels, from those undermined areas. I want to make sure that I keep the surface of the wound moist. I want to prevent trauma with dressing removal. What are my choices? And what am I looking for? I'm looking for a filler dressing, a dressing that goes into the wound bed. I'm looking for wicks that go into my tunnels or undermined areas, and I want them to be hydrating. I'm looking for a cover dressing that will maintain hydration, and I may need a cover dressing with a bacterial barrier. I want us to just think about how we typically manage these wounds. If you have a lot of patients who have dehisced abdominal incisions, I bet a very common dressing order is damp to damp gauze changed 2 to 3 times a day. So you think what you do, I'm actually going to back up a minute so you can just visualize that wound. So you think what you do, you go in, you put down damp to damp gauze into the wound bed, you cover it with gauze and tape, and when you do the dressing it looks fine. But as soon as you go out of the room, the patient stands up, sits up, and what happens? The dressing tends to fall down to the bottom of the wound. When you go back 6-8 hours later to do the dressing change, you frequently find that that gauze has become dry and adherent. And even after you moisten it, when you start to remove it, it might cause trauma and pain. So let's talk about what you could do that would give you better results. Here are some good choices. You could contact the physician and you could get an order to put down a layer of wound gel in direct contact with the wound bed, and then put damp fluffed gauze on top. You could then cover that with a transparent adhesive dressing like Tegaderm or Opsite, which would help to maintain hydration, would help to hold the dressing in position, and would provide a bacterial barrier. So you could do a layer of gel and then damp fluffed gauze, or you could take your gel and you could soak your non-woven gauze with the gel, and then you could fluff the gel-soaked gauze into the wound bed. Damp gauze by itself is usually not a good choice for all the reasons we've just discussed. It tends to stick to the wound bed if it's woven. So if you're going to use damp gauze in contact with the wound bed, again, you want it to be non-woven. The other issue with just damp gauze is you typically have to change it more often. What about the cover dressing? We were just talking about this. So gauze plus a transparent adhesive dressing is a very good choice. So a lot of agencies have established a very simple protocol for their dehisced abdominal wounds. They just put down a layer of gel, damp fluffed gauze. They secure it with transparent adhesive dressing, your Tegaderm, your Opsite, whatever type of dressing you have on formulary. What else could you use to cover this type of wound? You could use a silicone adhesive foam, because that will provide you with a bacterial barrier. It will tend to help retain moisture within the wound bed. Or you could just use gauze and tape. The problem with just using gauze and tape on a deep dry wound is that it allows dehydration at the wound surface, because moisture tends to evaporate through the gauze and tape, and adherence to the wound bed is a greater issue. Here are some sample dressings for deep dry wounds. So there's a variety of gel dressings here that you could place in contact with the wound bed. You could then fluff gauze on top, or you could soak your gauze with the gel and fluff that into the wound bed. You could cover with a transparent adhesive dressing, that's what you see here, or with a foam dressing. We're going to move to shallow wet wounds. So these are wounds that have no tunnels, no undermined areas, and no depth. You just have a surface wound that's wet. So your goals are to manage your exudate, keep the wound surface itself just moist, and to provide protection and insulation when possible. What are your options in terms of dressing categories? You can just use a cover dressing that's highly absorptive. Just pick one dressing to go on top of the wound that provides you with high-level exudate management. Or sometimes people will layer dressings to give them greater levels of absorption. So they might put down like a flat alginate or a flat hydrofiber or a gauze, and then cover with something like a foam dressing so that they have layers of absorption. So we're going to go back through our options in terms of specific dressings. Again, you're going to talk to your course coordinator about specific options available in your agency. Foam dressings, very, very commonly used for management of these wet, shallow wounds. What do? They absorb exudate very effectively. They provide an insulating effect that helps keep the wound bed warm and keep cells active. Most of them also provide a bacterial barrier because most of them are waterproof. And another advantage, foam dressings are typically changed every 2 to 3 days instead of every day or twice a day. Foam dressings available in a wide variety, so you can get non-adhesive dressings, which are great for extremity wounds because you can secure them with wrap gauze, but you can also get adhesive foam dressings for wounds on the trunk. When you look at your adhesive foam dressings, they come with standard adhesive, but more commonly we are using foam dressings with gentle adhesive. There are a variety of foam dressings available either with silicone-based adhesive or gel-based adhesive. Those types of adhesive are very secure, and yet they peel off with minimal or no trauma to the peri-wound skin. You can use your foam dressings as a standalone dressing for a surface wound that is wet, or you could put down that layer of alginate, put down that layer of hydrofiber, and put your foam on top. So foam dressings alone, one option. Using an alginate or a hydrofiber, the flat dressing, plus the foam, another option. Using your flat alginate, flat hydrofiber, plus gauze and wrap gauze or tape, another option. So bottom line, as long as you're getting absorption, you can do one highly absorptive dressing, or you can layer your absorptive dressings. You're just focused on exudate management and maintaining a moist surface. Could you use non-woven gauze? It's not going to stick to the wound bed, and it provides you some level of absorption. Yes, you could use that. You could then secure that with tape or with wrap gauze. However, your non-woven gauze is not as absorptive as your foam dressings, so usually not your first choice. The last thing that you could use a non-adherent contact layer. You could follow that with gauze and wrap gauze. Let me give you some examples so it will make sense to you what we're talking about. When we talk about non-adherent contact layers, we're talking about things like Adaptic or petrolatum impregnated gauze or Xeroform gauze, those types of products. So they're non-adherent, they go over the surface of the wound. They provide essentially no absorption, but they allow fluid to pass through so it can be absorbed by the cover gauze. So if you did Adaptic, you'd do Adaptic plus gauze plus wrap gauze. Petrolatum gauze plus dry gauze plus wrap gauze, those kinds of things. Are they appropriate? Yes, especially for extremity wounds. They're used a lot in those situations. So here are some sample dressings. Again, here are your alginate dressings that you can use. Here's an example of an Adaptic contact layer that's going to allow the drainage to pass through. And then there's a gauze tape cover dressing, gauze tape combinations, your foam dressings, another type of a contact layer. So you just want to go back to what are you trying to accomplish? You're trying to absorb. And as long as the combination of dressings that you're putting on that wound provide absorption, provide atraumatic removal, then it's appropriate. Many choices. You want to be very clear about what's available in your formulary.